I was at Vanderbilt Medical School, and I think the Roe v. Wade decision was done maybe in January of '72, and there was rejoicing all over the medical community at Vanderbilt that Roe v. Wade had happened. It was going to save the country. It was going to stop child abuse. It was going to stop the divorce rate. It was going to stop spousal abuse. It was going to just all of the ills that had come out of the sexual freedom of the '60s were going to be stopped by Roe v. Wade. I went right along with it because I was taught by people that were teaching me all sorts of things that this was the new way that the country was going to go forward, and that as physicians we were going to help the country go forward. And so I was not planning to be an obstetrician, but over the next few years decided to become an obstetrician and went through training, and of course was taught to do terminations. So I was in it from the start, and stayed with it until I began to see patients who, most of the time, if I did a termination, they would never come back because they saw me as something bad, and I don't blame them. Or if they did come back, they were they always brought it up about how remorseful and did they do the right thing and should they have done better. And I saw some really very bad abortion experiences with people who felt their baby was maybe still alive at the abortion clinic, or things like that where they went, people that had abortions that were coming to me as a known pro-life doctor. So I really was not a Christian at the time, but I began to be soured about the whole thing about abortion. I didn't become a Christian until '86 or '7, and I was involved in it and then rejected it. And I think that's what makes a lot of the pro-choice people very angry with me, is that I was on their side for 10 or 15 years before I wasn't. Well, then I had another patient who I didn't do her abortion. She had it done at Planned Parenthood. And she said she couldn't sleep at night. She kept hearing the abortion machine running. And it was running in the next room, and it wouldn't turn off. And wherever she went, this machine was running, and what could she do about it? And I sent her to a psychologist who told her she was crazy. A person with a terrible situation, her boyfriend had left her, and her family wanted her to get this abortion, and she didn't want to have it. And she was coming to me, and she was living in this efficiency apartment, and she was waiting tables, and they told her if she got too big, she couldn't wait tables anymore because they didn't want fat, pregnant people working at their restaurant. And it was just this, and you sit there and think, what are you going to do? And I said, well, you can go get an abortion, or if you really want to have the baby, I'll take care of you, just whatever you want to do. And I was very neutral for her, and then it turned out she was having twins. She got to have these healthy twin boys, and I didn't see her for a while. And then she came back in the later '80s with these two beautiful little boys. But the big part of the story is that she told me that if I hadn't encouraged her, she wouldn't have had them. And I don't think I encouraged her at all.
Last question. If you could turn back time and talk to the 30-year-old Dr. Trabue, and impart words of wisdom that you've learned over the years, what would you say to him?
I would tell him to start seeking the Lord earlier rather than later. That would be my best advice for him. It was the last thing he wanted to do when he was 38, but I would tell him that he needed the Lord before he needed anything else.